Hey, Dr. Ruth Roberts here. Hope you guys are having a great day so far. Out on the back porch, you can see it's a gorgeous day, and we had a nice rain yesterday, so everything's growing to beat the band, and the mosquitoes are growing really fast too. So hope you're having a great day, and storms have all rolled past you. I hope you've been enjoying this series, and I've got a couple of questions from folks that I'll answer for you as best I can. I have to tell you, it's unusual being on your end of the stick as far as worried about a pet who's sick. So since I have sold my practice, I'm thankfully able to. Hey, good morning, Leticia. Great to see you. Great to see you. So since I sold my practice, I have had some stuff to attend to, and one of my own dogs got sick, so it's kind of weird being on the waiting end of figuring out what's going on. Thankfully, it just looks like he's got some plain old gastroenteritis, ate something a little funky, and it upset his tummy, so far so good. I know how worried you get. I know how worried I was this morning, because my buddy Esau is 14, and so that's when life can get a little tricky sometimes. So Lisa Kling, who was a client at Sundog Cat Moon, asked that I speak a little bit about dementia in dogs. And this is something that is, just as it is in us, it's growing to be a huge problem for these guys, largely because they're living longer, and also probably because of diet changes, interestingly enough. So on the human side, they're beginning to understand that Alzheimer's disease, we thought maybe it's the aluminum, maybe it's this, maybe it's that. What they're starting to actually call it, interestingly enough, is type 3 diabetes. So that's frightening. And so one of the proposed mechanisms for the increase in Alzheimer's in people is because we're eating this highly processed, highly carb-based diet. And if you've been following the news, Gary Taubes, who's written extensively on different nutritional and health issues, recently published a book about sugar. And it's starting to come out now that the sugar industry back in the 70s had several studies done that showed that, yes, fat was what's bad for us, when in fact the real science was showing that trans fats, which I think are finally supposed to be out of the American food supply in 2018, and sugar is what was causing the increase in cholesterol plaques, the increase even then in diabetes, obesity, things of that nature. So the sugar industry got it squared away so that no, fat is evil and you should eat a high sugar diet because that will actually help you lose weight. Well, if you are like me, that didn't work out so well. And if you think about, if you're old enough to think about this, it just doesn't work. So if you take a high sugar diet, you're going to do several things. And the reason I'm kind of going through this is because this is actually how most of our pet foods are being made now, as a high carbohydrate diet. And Leticia and guys, thank you so much for sharing this video with other folks. I think the more information we can get out there to people, the more they can help their pets by making informed decisions. So, interesting thing on the human side is that as sugar went up, so did obesity, so did diabetes, so did heart disease, so did arthritis, so did all the stuff that's costing us literally billions and billions and billions on the human healthcare side now. In the dog side, as our diets became highly processed carbohydrates, well, that happened on the dog food side. So there's a long history in conventionally produced pet food to use the stuff that we wouldn't eat. So the bits and pieces of corn and God knows what else that we couldn't eat, or that the food industry couldn't figure out to turn into something that we would eat, got put into pet food. So in 2006, with the first pet food recall, now we all say, oh, it's wheat. But actually what it was is a very bizarre, and I forget what they even call it, but essentially there's wheat middlings, which is the little kernel of where the active DNA is for a wheat germ. some little piece of that was actually processed into a higher protein wheat, and the Chinese added melamine to that to make it pass as higher protein. So that's where that first pet food recall came from. So in dogs and cats, we're seeing exactly the same thing happen as we are for ourselves. They have increased incidence of obesity, diabetes. The heart disease, not so much. For some reason, they don't actually form the plaque that we do. And so that's not so much of a problem. But everything else, the arthritis, the malaise, the lethargy, the lack of desire to go outside and play, things of that nature, those are all on a rapid increase. Along with them are cancer, kidney failure, and all the other yucky stuff we think about. So if we go back to the functional medicine approach to what's going on here, sugar, it creates inflammation because overall what happens is your body is in this surplus of sugar and your liver begins to struggle to be able to process it properly. As that happens, it shuts down the liver's ability to detoxify, and it also shuts down the gut's ability to detoxify. And the reason that's important is that now the immune system can't really do a very good job of surveilling for cancer cells. The blood sugar level stays higher, your cells become insulin resistant, meaning that you may produce insulin still, but it can't attach to the little receptors that let your cells know to take sugar into the cell. And so that sugar gets turned into fat pretty quickly. So we've got this whole shenanigans going on where the metabolic system is completely out of whack. So that is the super frustrating thing to me. So the first thing I'm going to tell you is that it's time to drop the carbohydrates out of your pet's diet. And there's multiple ways to do it. You know, my website is called the original Crockpet Diet, and that's because I developed a recipe that uses whole foods that you control to make pet food with, and it puts it back into a ratio that's appropriate for both dogs and cats. So that's your first step. Reduce the carbohydrate load, even if for your dog to help keep and your cat to help keep healthy, and then use more vegetables. So brassica species vegetables, things like broccoli, kale, those things help the liver do a better job at metabolizing the waste products that are out there. And the increased fiber helps your gut stay healthier so that the immune system that lives within the gut is able to do its job. But even with everything you can do in prevention, as we age and as our pets age, we begin to see symptoms of dementia. And it's a little tricky, and it is tricky with people too. You know, you may notice a few slips here and there in your father, your mother, some older relative or friend, and then over time it becomes abundantly clear that their brains really aren't working as well as they used to. So what are the symptoms that we're going to see in dogs and cats? Obviously, they're not driving, so they're not going to forget how to drive or how to get somewhere. But you may notice things like they're pacing quite a bit. They kind of go into a room and stand there for a while, like they forgot what they're doing in the room. They start to go outside and just kind of get downstairs and stand there and look around and then come back up and then urinate in the house. And you're thinking, what's going on? Why is my dog not housebroken anymore? Or why is my cat not urinating in the litter box anymore but like 2 feet away from it? So what's happening is their brains aren't processing things quite correctly. They know they've got to do something, but they're not quite sure what the thing is. The other thing you may see are symptoms of sundowner syndrome. If any of you have had relatives or friends that have had dementia or Alzheimer's or just plain old garden variety senility, which I don't think is discussed much anymore, it's somewhere between 2 o'clock and when the sun actually goes down, as the sun is sort of setting, and it's on, if this is noon where the sun is, as it goes further into the west, people start to act a little squirrely, and dogs can do as well. So you may see things like, again, pacing, really sleeping a lot, being agitated, and just a variety of different things that show you a fairly marked change in behavior, loss of housebreaking, confusion. They may start to eat and kind of seem to forget what they're doing and not finish what they're eating. They may forget that they've just been fed and then come hound you for more to eat. So unfortunately, my father had dementia, and that's what I watched him do later in life. He would forget that he had eaten lunch and then go ask my mother for lunch and then argue with her that no, he hadn't eaten lunch. And so it got to be really crazy. And it's the thing, you can't help somebody understand that their situation very well when they're in the middle of it. Same thing with your pets. You might guide them back to go back outside. No, you didn't go potty yet. Let's go back outside. So what we see most often in our pets, though, is that they're up around 2 or 3 o'clock in the morning and they're pacing, and you're listening to their toenails tracking across the floor. So that's really it's frustrating because it's not their fault. But yet they're exhausted in the morning, you're exhausted in the morning because you've been awake for half the night listening to this, and so it just gets into this super frustrating situation. So those are kind of the symptoms that you may see with Alzheimer's or senility, or in dogs we call it canine cognitive dysfunction syndrome. And then, so what are the things that you can do about it? On the conventional side, just as in Alzheimer's and dementia, there aren't really very good medications available. So the one that's discussed in veterinary medicine is anapril, which is a drug that failed the human market. It made no statistical difference whatsoever for people that had symptoms of or were already diagnosed with Alzheimer's or dementia. I think the drug statistics are something like there is a 50% improvement with placebo and a 65% improvement with the drug, which is not very much and very disappointing. So the things that have worked well for my clients with pets that have dogs or cats, and most often it is dogs that have dementia symptoms, is to, one, if you're not already feeding the Crockpet Diet, start feeding the diet. Change it gradually. None of us like change. And if your pet's older, its GI tract is going to be more sensitive to change. So normally we'd say, if your dog is healthy or your cat is healthy, take a week to transition over to a new diet. And so in this case, I would say take 2 weeks to make sure we don't upset the apple cart and create GI symptoms that just didn't need to happen. The other thing that's been very helpful is alpha lipoic acid. And this supplement is a great antioxidant that seems to be specifically targeted to the neural or brain tissue. We've seen, I would say, 75% of the dogs that have taken it, and I've not had much experience with using it in cats, partly because cats are cats and sometimes they won't take it, sometimes they will. But I would say with dogs consistently, we see about an 85% improvement. The other thing that can be very helpful is CoQ10. If you're not, if you don't know about CoQ10, I'd really encourage you to read about it. So CoQ10 is essentially one of the coenzymes that the mitochondria, which are the little power plants in your cells, absolutely need to keep running efficiently. As we get older, as our dogs get older, as our cats get older, we don't make it or assimilate it from the diet very well anymore. So taking this in supplement form can make an enormous difference. My mother jokingly started, she said, well, what can I do? So her golf game was suffering. This is the most important thing to her in her life. So I said, well, try some CoQ10. And she called me back about a month later and said, oh my goodness, that, it made her focus go way up and her ability to concentrate through the game. She'll be 78 this year. She's still driving. She still is in great shape mentally and really great shape physically. So these are the things that she wants help with. So it's made a big difference for her. It's made a big difference for a lot of dogs and a lot of cats. So if you supply the power plant with the raw materials that it needs to produce more fuel for your body, everybody's going to win. In humans, there's a lot of discussion about keto diets or nutritionally adapted ketosis. And Ketosis, if you're diabetic, is horrible and scary. So this is not that. What we're doing is converting ourselves from being sugar burners as our primary source of fuel to fat burners. So ketones are produced when your primary fuel source is fat, and they are broken down into small molecules like short-chain fatty acids like butyric acid, things of that nature. And they do two things. One is they feed the good bugs in the gut. And if the good bugs in the gut are happy, as we've discussed many times, the rest of the body gets really happy. We talk about the immune system in the gut. We talk about it resolving the good guys, resolving GI issues. But the other thing to remember is that the GI tract, when it's functioning well, produces over 90% of our neurotransmitters. So if your GI tract is off and your neurotransmitter production is off, it is a recipe for disaster as far as, how you're going to be able to think, how you're going to be able to react to things and get your way through your day. Your learning skills go down, you forget things of that nature. So two benefits. The second is directly in the brain. Your brain loves fat, and in fact it is composed 80% or 90% of fat. So the cholesterol that we've all been worrying about for decades, you need it to make more myelin, which is the sheath around your neurons, and it's sort of like the insulation for the electrical conduction. If the insulation is broken, or it's got a gap in it to where the conduction can't continue, then that neuron is toast, essentially. It's out of the ability to function. And as we age, we lose neurons. And so if the majority of your neurons don't have adequate myelin wrapping them and protecting them and helping them to conduct what your brain is telling the rest of your body to do, you're going to show up with some pretty icky stuff going on there. So higher fat diet, again, be very, very gradual with this. So where most people forget to look, there's a couple of ways to adjust the original Crockpet diet to be more fat-based rather than carbohydrate-based. It's already at about 30% carbohydrate versus 67 to 80% carbohydrate in most commercial pet foods, and 60% to 70% for cats. So you can gradually adjust that up. In our Crockpet Cooks community, we've been able to help several people do that for pets that are diabetic and also have seizures, to help improve seizure control as well. So that's another important step to take. And that's kind of what I've got. We've had a couple of dogs where they're older, they're 10, 12, they're already developing symptoms. The diet change, the alpha-lipoic acid, and the CoQ10 help, but they're still up pacing at night. And so in that situation, we've tried multiple things. Sometimes adaptol collars will help relieve the anxiety. Sometimes liquid Nutricalm, which is tryptophan and theanine, helps tremendously to help the pet stay asleep so they're not up pacing all night. And then in some cases, I've actually resorted to using a low dose of phenobarbital. And while it's not the best solution, it's been helpful in that the dog sleeps at night, the owner sleeps at night, everybody wakes up feeling better. And then during the day, for the pet, the symptoms are better because they've slept well that night before. So that's another consideration. Phenobarbital is a drug that's generally used to control seizures, but in this case, we're using it as a low dose to help sedate the pet, really, to be honest with you. We're reducing that anxiety that comes with not quite being sure of where you are and what you're doing. So if you can imagine that, waking up at 2 o'clock in the morning and you don't know where you are, you don't know what's going on, it's dark, nobody's up, you're confused, and so you get up and start kind of poking around trying to find stuff. So that's what I can tell you about dementia, and I am hoping that's helpful to you. Lisa, I hope you were able to get on today, and if not, this video will be there. And I'm just kind of scrolling it over to see if you guys have got some questions for me, see what I can answer for you to help make that make a little more sense. The other thing certainly that's important is making sure that your pet is getting all of the nutrition that it needs. And I'll put in a shameless plug for Holistic Total Body Support, which is our multivitamin that we've just brought to market in the last month or so. It's been awesome because I've been looking for something like this, and I finally ended up having to make it. It is a multivitamin that will support both dogs and cats on a home-cooked diet. There's enough taurine in it for cats to make sure that they stay safe and they don't develop a dilative cardiomyopathy from having low taurine in the food. And the other thing that is just awesome about it is the glandular support. So again, if we think about our pets, so many of them now are spayed and neutered before they ever hit 6 months of age, and so we're asking their adrenal glands to take care of all of the function of being adrenal glands as far as producing cortisol and mineralocorticoids to keep your fluids and electrolytes in balance. And then now they have to take on the responsibility of producing low levels or physiologic levels of sex hormones to keep your pet healthy and feeling well. So that's another important thing. But go check it out on the website. It's still buy one get one free until the end of May. And Letitia's asking, her mom cats urinates on furniture, even in front of her on the bed. And she's changed the brand of food to a prescription brand. And sounds like you're telling her about the Crockpet Diet. And I think that's one of those things where it's really confusing. So is this an older kitty, younger kitty? If it's an older kitty, it's possible that it is dementia or something similar to that. The other thing we forget too is that cats are really good at hiding things, and actually dogs are too. And so more likely what this is either a urinary tract infection, urinary crystals, and dogs and cats form those, and we typically do not. And then the third thing is that cats in particular, and we're seeing this more and more in dogs, get something similar to interstitial cystitis that we get. And what interstitial cystitis is you feel like you have a urinary tract infection. It burns, it hurts, you have to go to the bathroom frequently, but you actually have a sterile urine. And so what happens in women, and this happens in the humans more in women than in men, is we get stressed, and unfortunately, and we worry a lot, and unfortunately our bladders can end up taking the brunt of it. Cats do as well, and we look around and think, what in the heck does my cat have to be worried about? But their behavior is such that, if something happens out of the ordinary, they like to be creatures of habit, or there's disruption in the house, or if you're stressed, they feed off of your stress. So a great thing to do is make sure that they don't have an infection and that they're not forming crystals. The goal of the prescription diets is to put the urine pH in a particular range to prevent that. You can do that with cooked food as well, and then the increased moisture in the food does tend to help prevent urinary tract disease. And so if it comes down to the fact that nope, no infection, no crystals, probably interstitial cystitis, there's a couple of things you can do. One is Feel Away, which is a pheromone for cats. There's not a collar that works very well for kitties, but there is a plug-in wall diffuser, and so that can be very helpful. It lowers their stress level down. If there are multiple cats in the household, make sure that one cat isn't threatening the other one, and this can be really difficult to see. So all you may see is the cat that has a urinary tract issue sort of crouched and over in a corner somewhere, and then the tough cat standing like this. And so that's actually one cat threatening another. Cats try to use as much body language and vocalization as possible to display threats rather than actually fighting. So there's too much. Yeah, and so Letitia's mom has got a cat and a dog. And so then if that doesn't work, that's not an issue, thankfully. So, and probably not. Dogs and cats tend to get along really well. Then the other thing that's been helpful is chondroitin and glucosamine, which you think of as a joint supplement, but it is an overall anti-inflammatory. And then injections of Adequan, which is a precursor to glucosamine and chondroitin, and that's been shown to decrease inflammation in bladders and things of that nature. There's a bladder support product I've used for years that has Romania, which is a cooling herb, so bladder heat in the causes any symptom of urinary tract disease. In Chinese medicine, that's the pattern diagnosis, is bladder heat. So cooling herbs, pumpkin, saw palmetto, several other things to help reduce inflammation in the bladder. And then on the prescription side, there are some cats that really are anxious. And so that's where, I hate doing it, but on the other hand, if it brings them relief, it's a good thing. So that's where you could consider something like Prozac. If the cat is not very confident, another medication called Buspirone has been more useful. And in many cases, you can use that medication for 30 to 60 days to kind of help the kitty reset how they feel in their environment, for lack of a better description, and then discontinue it. Again, liquid Nutricalm is another great option, helps take the anxiety down. So first thing is just make sure there's no infection, no crystals. Go to a wet food if the cat's eating dry, and if they're already eating wet, then I would try to go to the Crockpet Diet, and then use the holistic total body support to help support their stress level and start to repair tissue that's been there. So hope that's helpful, Leticia, and that your mom gets some help from that. Leticia is the person that's been putting up all these awesome photos and videos, and just really love the work she's doing to help support us and help us all feel good about what we're doing to help our pets. So has anybody else got some questions? Would love to hear them. And if you don't, next week we'll be back on Thursday at 12:30. Let me know what you want to hear about. There's questions out there that just don't have good answers in conventional medicine, and so if I can give you some options to talk with your veterinarian about, then I'm doing my job. And if you have questions, message us on Facebook, go to the website, and email us at support@theoriginalcrockpetdiet.com. Let us know what we can do to help you, to serve you and your pet. And remember, your pet's best health starts in the bowl. Take good care, and we'll see you guys next week.